Hi, students. Just a few things I'm going to go over on how to code a medical record. The case study assignments and discussion were created to give you a real world experience in coding. As you can see in my lesson one lecture, I included some information regarding coding from an actual medical record. This information, in addition to the information that you should have learned back in HIT 101, will assist you successfully coding from a record. However, it's easier said than done. Here is how I break down a record when coding. So the first page is your face sheet, admission record, other names depending on what facility you're working at. This page will frequently list the diagnosis and procedures. It's okay to look at this, get a feel for the chart. However, you should never code a record based on this information alone. So you never ever want to code just from the face sheet. It is a good idea. I always take a piece of scrap paper and a pencil while reviewing the record so that I can jot down any pertinent information that you might see while going through the record. If a discharge summary is available, then you are halfway there. Sometimes I review the history and physical first so I can get an understanding of why the patient came to the hospital in the first place. Then I go and review the discharge summary to get an overall picture of what progressed while that patient was in the hospital. Remember, a discharge summary is the whole story. If there was a procedure performed, there should be an operative report, and I would review that next. If a diagnostic procedure was performed, I would look for the pathology report. Most of the time, these reports are dictated and transcribed. However, that is not always the case. You may find a handwritten H&P in the progress notes, depending on the availability of the EHR. Hopefully, at this point, everything is electronic, but once again, you never know. Yes, my favorite handwritten progress note. They often look like some kind of scribble, but there is a valuable information and you must dig for it. Once you work at a facility for a while, you'll get used to each doctor's handwriting. Many hospitals have EHRs, but there are still a lot of hybrid systems in which progress notes are still handwritten and scanned. Keep your eye out for SOAP notes, remember from HIT 101, and you want to focus on the assessment. Remember, you have the subject objective, which the objective is the examination, and then the assessment, and then the plan. So the assessment is where you find your diagnosis. I also look at labs, but here's the deal with labs. You must confirm any abnormalities you find in the physician documentation. The radiology imaging reports must be reviewed as well. I do not focus on nursing notes unless there's something that is just not right or I cannot determine from the physician documentation. A nursing note may clear it up and then you can find proof in the physician documentation. The medication sheet, they're helpful determining what is being treated. So at that point, you can decide which chronic or comorbid conditions should be coded. Okay, and also remember to always code smoking or a history of smoking since it's such a negative effect on the health of the patient. You should also code the Z code for any allergies the patient may have. I hope this little lecture helped, just kind of a briefing. Just remember to carefully review the record. Post your discussion, review other postings for the graded discussions, upload your assignment document by the deadline. Best of luck, students.